We'll start with how do you become a nurse. So there's a couple different ways. There's different programs out there. There's a 2-year program, and then there's 4-year programs, and then there's actually master's degree programs. At the University of Minnesota, we do not offer any 2-year programs. So I'm not going to talk about that. That's something you'd have to go talk to the community colleges. I do recommend that if you're interested in nursing that you do a 4-year or master's degree program because the research does show that 4-year degrees, there's better outcomes in nursing. Not that there's anything wrong with a 2-year degree, but just as we look towards like the future of nursing, it is moving towards a 4-year degree. The 4-year degree that we offer at the University of Minnesota is a traditional undergraduate degree. It's 4 years. If you were coming into it, it would probably be about 3 years. This is our admissions person, so she's our expert. This is Rebecca. You can always email her or her office if you have questions. So you would apply like you would apply to any other program or transfer if you're interested in transferring to the program. And Rebecca can answer all those questions. But you would spend 3 years doing nursing clinicals. So clinicals in medical surgical nursing, pediatric nursing, the whole wide spectrum. Another option at the University of Minnesota is the Master's in Nursing, which is for people like you who will have completed a bachelor's degree in some other topic that they have no desire to continue on for the rest of their life. So the MN program, so we call it MN, so Master's in Nursing, is a 16-month accelerated program. We admit once a year, and the program starts in the fall, and you go 4 semesters, fall, spring, summer, fall. So you would graduate in December, 16 months after you started the program. And so at the MN, you get all your nursing classes, and we do have the expectation that you come in with all your science classes completed and a certain number of prerequisites. And all of that information is available at our table out there, and Rebecca can also answer it. We also offer information sessions throughout the year. Now, doing the traditional or the MN program, what it does is it gives you the ultimate goal of becoming a registered nurse. So upon graduation from either of those 2 programs, you would be eligible to sit for our national certification exam, which is called the NCLEX, and then you would be upon passing that, you become a registered nurse. So you can work in the hospitals, you'd be credentialed to do any job that a registered nurse could do. So, what are your questions about that? That's like the short answer. Okay, so the MN, we admit 64 people a year into the program. It is a very competitive program. We usually get over 300 applications for those 64 slots. We're looking not just at your grades and not just at your GRE and not just at, the core numbers. We're looking at your life experiences, who you are and what you can offer, and why you chose nursing. So we hope that the people who come to us aren't choosing nursing because they have nothing better to do and they realize that their European history degree didn't give them a lot of job perspectives. We're hoping that there's a passion for nursing and that they're going to use whatever their experience is to help make nursing a lifelong career. So once you complete your MN degree or your traditional undergraduate degree, you would have the option of applying for advanced training and a Doctor of Nursing Practice, which is what we have here. And so the director of our program is Mary Chesney, so that's not me, but you're always welcome to email Rebecca or Mary if you have questions, and I think you guys have the slides. So we're going to skip that. So the School of Nursing, we have a lot of people. We have over 100 faculty, over 800 students, and we're one of 6 schools in the Academic Health Center. So we're with the medical school, the dental school, pharmacy, what are the other, nursing, vet med, and public health. So those are the 6. So it's a really large school. We're located right downtown off Harvard Street, near the hospitals down in Minneapolis, right across from the stadium. Yeah.
Sorry, I really wanted to. So like for like the master's in nursing, I know like some other prospects like they require you to have like your CNA license and be like CPR certified, so that's not required for this one.
We would require CPR certification, but you can't go into a hospital as a student nurse without a CPR qualification. But we do not have a, right?
Not upon admission.
Right.
Or part of your application, but yes, before your.
But not the CNA thing.
Before I start.
That CPR.
Yeah.
CNA is not required.
No, but we do not require like LPN, CNA, nursing assistant experience, anything like that. Yeah. So, There's two different advanced practice degrees or advanced degrees, and so there's a little bit of confusion, so I'll just take 30 seconds to explain it. A PhD is a research degree. So a lot of your professors here have PhDs. They're interested, in research. They do research. They're developing new ideas. The Doctor of Nursing Practice, the DNP, is an applied research degree. So the purpose of the DNP is to prepare advanced practice nurses, so nurse anesthetists, nurse practitioners, clinical nurse specialists, at the doctoral level so that they can apply research and affect systems change. So make healthcare better for the population at large. So that's the point of the Doctor of Nursing Practice. And we've moved away from a master's degree in, for nurse practitioners because we recognize that having a doctoral level training and being able to affect the healthcare system is a really critical part of being an advanced practice nurse. So to try to, just give you the clinical skills doesn't give you the opportunity or the ability to really change the clinic you're working in. And we want to make sure that all our graduates have those skills. So why the DNP? I'm going to skip the postmasters though. But it's for those who have a bachelor's degree in nursing or another subject who come to nursing. It says BA or BS, but it really, you have a BA or BS in nursing and are looking to be an advanced practice nurse. And so we talked about this a little bit earlier. That includes nurse midwifery, nurse practitioners, nurse anesthetists, public health nurses, clinical nurse specialists, integrative health and healing nurses, psych mental health nurses. I mean, we have a huge spectrum of what we can offer. It's for those people who want to work in clinic settings or hospital settings in a higher level. So you would be a healthcare provider that have the ability to do assessments, prescribe medications, prescribe treatments, and care for patients in that way. So the next level of nursing. The DNP, I'm going to skip the postmaster stuff because it doesn't really apply to you guys. So as part of the DNP, you're required to do a leadership project. And that leadership project is what we were talking about, the systems change. So you'd spend 3 years, 3 or 4 years, 3 years is full-time, 4 years is part-time in most programs. I'm speaking because I primarily teach in the nurse midwifery, so I'm talking like what I know of nurse midwifery. So it's 3 years for full-time, 4 years for part-time. And in that time period, we train you for your clinical degree, and then we also train you to affect systems change. And at the end, similar to a dissertation for the PhD, we have you do a clinical leadership project where you go into a clinic or a healthcare system or some sort of system where healthcare is taking place, and you do some sort of change. So you apply research. And so some examples are using health coaching to decrease glucose levels, high glucose levels in diabetics in a rural clinic. That's one of my students' projects. Another project would be implementing centering pregnancy, so a group prenatal visit into an OBGYN clinic. So the student goes in, they have an independent project where they make some sort of change within a clinic setting or a healthcare setting. Does that make sense? So it's a huge project. You work on it your entire 4 years that you're there. We give you all the tools, and then you implement and evaluate that tool. And you can see there's a whole bunch of courses that prep you for that. So if you're interested in the DNP program, first you need to have graduated with your bachelor's degree. So I'm going to skip ahead because we can get to the applications. So if you have a bachelor's degree in nursing, then what you're going to do is you're going to apply. Is it on the next slide? I don't have the slides in front of me, so it's hard to remember. I looked at these slides, I swear. Just didn't do a very good job of planning it. Because there's the list of all the things you have to do.
2 slides ahead is the specialties areas, and then maybe 3 slides is there.
Okay. So as a post-bachelor's, if you're interested in becoming a nurse practitioner, a nurse anesthetist, you'd finish your bachelor's degree, and then you'd apply to the DNP program, or apply while you're still finishing in your last year of your bachelor's degree. You would apply. You need to have your GRE scores if you haven't already taken them for another program. You need to write essays. You need to turn in all your transcripts, and then there's also an interview. What else?
Letters of reference.
And letters of reference, 3.
So you do need to take your GRE.
Yes. And you do for the MN program as well, right? No. To be determined. Okay.
Just because in your pamphlet it said, just because
have the option to waive your GRE. So it's just a little form to fill out.
Yeah. So you take, so these are our specialties: informatics, epidemia. Oh no, these are the courses. I'm sorry. I can't like look backwards. I feel like an idiot. So there's 13 specialties: adult gero, CNS, which is a clinical nurse specialist, adult health gero, nurse practitioner, family nurse practitioner, informatics, integrated health and healing, nurse anesthesia, nurse midwifery, health innovation and leadership, a pediatric clinical nurse specialist, a pediatric nurse practitioner, psych mental health nurse practitioner, public health nursing, and then a women's health nurse practitioner. So we have like